We're here at the 2011 Indy Winter Classic, and it's the Hoosier Kennel Club and the Central Indiana Kennel Club. We're Scout Zoe's, and we have Dr. Terry Grieshaber from Circle City Veterinary Practice. Did I say that correct?
Correct.
Okay. How are you doing with the show this week?
Oh, we're rather enjoying it. This is the first dog show I've actually attended myself, and it's been an educational experience.
Sweet. Well, the way that, for everybody who doesn't know, the way that Dr. Grieshaber is associated with Scout or Zoe is that Zoe is Dr. Grieshaber's patient. Zoe has suffered from a multitude of allergies for a really long time, and she's about to be 11. So I know that Rowdy, your dog, has allergies, and we tried him on a chew. How did he do?
He did really well with it. He is a food allergic and a dog that has inhaled allergies. And once we gave him the dog chew, it didn't seem to bother his food allergies at all.
I think he's on his second chew now, right?
He is. The first one lasted him about 8 months. So they are very durable.
He's a good dog. About time for him to get another one, isn't it?
Not quite. This one's only 2 months old.
Well, we got a little bit of way to go then with that.
Yes.
So for dogs that have allergies, it's a pretty slim percentage of the population, is it not?
The dog population in my practice, about 10% of them. In the general dog population, somewhere in the neighborhood of 1 to 3% of the dogs have food allergy. As far as it affects the skin.
Okay, so for, in your opinion, and we know we've had conversation about anything hard that's being chewed or consumed, that if they obsess with it, they can crack their teeth. So we always caution people on how long to let their dogs chew on them. Has Rowdy had any problems with this?
He is not. He's more of a nibbler. So he'll pick it up, he'll carry it around, he'll nibble on it for 10 minutes or so, and then he moves on to something else.
Good. Well, we've done really well with the chews, and we know that there's a huge population out there who don't know that their dogs have allergies, and you are the man here in Indiana with allergic specialties for animals. So if you were going to give somebody advice that has a dog that maybe they don't know that has allergies, first of all, how would they figure out that they did have allergies?
Whenever you're looking at dogs that have food or inhaled allergy, the primary concern is that many of these patients have recurrent ear canal infections. Many of them spend a lot of time licking and chewing at their paws, scratching the axillary or armpit regions, if you will, the belly area, recurrent bacterial and yeast infection of the skin. And food and inhaled allergy in the dog look pretty much the same.
Okay, so is there any process, since you are, once again, the allergy expert here, a process of elimination that they can go through to determine whether or not they do have allergies?
If you're thinking in terms of food allergy, typically you're doing an elimination diet. You're putting them on diets that are specifically formulated to rule food allergy out, or you're home cooking using protein sources that these animals have not been exposed to before.
So like a food challenge?
Exactly. Doing blood testing or skin testing for food dietary allergies, typically not particularly effective in the dog.
Okay. Well, and I know that Rowdy has enjoyed his chews, and the multitude of Central Indiana and now nationally, dogs are enjoying Scout and Zoe's chews. Any information that you'd like to pass on from your personal experience with the chew product that might benefit other people looking for an alternative to beef bones or rawhide or something like that may not be good for their dogs because of allergies or just because it's just not good for dogs?
Well, certainly the protein sources in the antlers are typically somewhat unique to dogs, or they've not been exposed to them before, and in our case, it seemed to work pretty well for him.
Great. Thanks for coming. We really appreciate having you here.
You're welcome.
Dr. Grieshaber is the official vet of Zoe, and we appreciate his time today here at the dog show, and thanks for coming.
Thank you.